Live Furniture Macomb, Thursday Open Lines continues, and our next guest is Miss Tina Brumfield. She's with Hospice Ministries, and it's always good to see your smiling face, Miss Tina.
Good morning, Robert. It's great to see you. And talk about light furniture. There is a chair up there I'm going to go buy when we're done. It is adorable. It's called Sprout. That's
Sprout.
Yep, Sprout.
Yeah.
So I'm going to go buy. It's adorable.
Yeah, it is. He's got a bunch of adorable stuff in here. My wife says that too.
Yeah.
So,
I think it'll be okay if I buy it while Pat's out of town.
I think it'll be okay. It's all. You know what I have found out? It's easy to ask forgiveness.
Oh,
You know,
absolutely.
so it's
That's
a lot
why we're
easier.
spending the night in New Orleans.
There you go. There you go. That'll be a lot easier.
That's
That'll make it a
right,
lot
that's right.
easier. So.
Well, I'm delighted that Alan invited us here today. I am with Hospice Ministries, and we're the only Mississippi hospice. We're the only community-based hospice that's not for profit. And those are important for many reasons, but I'm here really to talk about hospice in general. And people say, well, how do you work for hospice? You know, how do you work when you know people are dying? Well, that's one thing that we're promised, you know, in the Bible, that we will die, we will all die. And why not do it with dignity and comfort and compassion and with experts that know what they're doing? Because we're all afraid of it, but if we have someone knowledgeable with us and Christ-centered, then it's the way to meet the Lord.
Right. Well, I tell you, one of the first things that I thought about when I knew you were going to be on the show today was, you know, either everybody listening knows somebody that or has dealt with hospice firsthand.
Absolutely. And that's what's so wonderful about is hospice is it's becoming more commonly known. And really, one of my jobs is to educate the public and people to not fear the process. And every time I speak with a family member or patient, the first thing they say is, we should have called you sooner. We should have called you sooner. And the statistics show that people on hospice live longer than people without it. We've had many patients that have gone off our service, that have actually done better and gone off our service after they've relaxed, after the fear of their family members. The fear of a dying person is that their family is scared. Right. They're ready. It's their family that they want taken care of. And that's what our team does, is envelop the whole family, not just the patient.
And there's got to be some comfort in being at home, too, that plays in. So.
And you will find some people, that is their wish to die at home. We also have inpatient treatment here at Southwest Regional Medical Center, as well as King's Daughters in Brookhaven. We also have the only inpatient hospital in the state of Mississippi, in Ridgeland, that is absolutely gorgeous, the most beautiful chapel you've ever seen. You can stay with your family member there. We even offer family members, of course, when you are, hospice is designated as someone who has 6 months or less to live, according to their physician. And when you're given that diagnosis and no other treatment is available to you, then what we do is come in and alleviate your symptoms, such as pain management, comfort, anxiety, someone to be with you, and that level of care. So that's what we offer.
Now, hospice is not just here in Macomb, Pike County.
It's all over the nation.
Yeah, right.
It started in the 1500s in England, and Mother Teresa was one of the main supporters of hospice. But it's been in Mississippi since probably the early 50s, and we are a founding member of the Mississippi Hospice Organization.
Okay.
So,
now, your office that you work out of, is it just Pike County? Do you kind of handle the Pike County area, or the office here, or does each county have an office, or how does that work?
We have offices strategically located throughout the state. Our office handles Pike County, Amite County, Wilkinson County, more or less those areas. And then we have an office in Lincoln County that goes up that way and then to Ridgeland.
So they kind of have their own little regional areas.
I want to tell you one other nice thing about Alan Smith and Light Furniture.
Okay.
Michael Gattuso mentioned how he has partnered with, he and Siri and Little Morgan and of course Danny, her brother, have done many things for the community and helped the Arts Council. They also helped us by supplying the furniture for our office here.
Wow.
And all we had to do was mention that we're opening an office, and Alan and Siri called and said, what do you need? So that's the level of support that we've gotten from Lot Furniture, and we're one of many organizations that's received that from this family.
Right. Now, you've been with hospice for several years now,
Well,
haven't you?
I've been I worked 20 years at the hospital,
Right.
and learned a lot about medical care, and I love health care and that sort of thing. And I still get to call on physicians, which is one of my favorite things. We have a great relationship with Norman Price, administrator at Southwest Regional, who has been so supportive of us. So I still enjoy that, and I still enjoy an educational opportunity.
Okay. Now, how can folks get in touch with hospice, or do you have volunteers of people
We
that
do.
come in?
I'm glad you asked. That's an excellent question. Our volunteers make up, we are required by law that 20% of our load is volunteers. And Alan's daughter Morgan, I think who will be on the show later, has been one of our volunteers. There's no age limit. There's no, we need help from office work to sitting with a patient. You can imagine a family member with somebody 24 hours a day that may want to go get their hair done,
right,
or go to the grocery store. And we have volunteers like Dale Felder, who has a standing lady she sits with once a week and brings her vegetables out of her garden and things like that. It's all levels. We have some that write notes to patients.
Wow.
So we encourage volunteers. Our number is 601-249-3852 in the Macomb area.
All right.